Do you have knee arthritis?
Okay, we're gonna give you the top 10 ways to treat your knee arthritis without surgery. And this is coming from 2 surgeons.
Hang on, we're surgeons. Why are we telling people to do it without surgery?
Because we'd rather have people treat it without surgery because surgery has risk.
Okay, well, before we start, we should thank our sponsors.
We literally have 0 sponsors.
We have no sponsors.
Not a single sponsor.
We've never had a sponsor.
We've never had a single sponsor.
None of our videos are sponsored.
7 years, no sponsor.
All right, what's the first thing you can do?
We are sponsored by activity modification. So that is your #1 treatment for knee arthritis, modifying your activity. So we would always tell people to move. So it is critical to keep moving, even if you have sore hips and knees. But what we would tell you is, if something really, really hurts, consider modifying it or not doing that specific activity.
Okay, our second sponsor is weight loss.
Okay, sponsored by weight loss.
Weight loss, if you are carrying too much weight, that might be increasing your pain from your knee arthritis. So weight loss might help.
We've talked about the analogy, particularly going up and down the stairs, that it increases the amount of weight that goes through your knees by up to 7 times. So if you had like a knapsack on that had 30 pounds of butter in it, and you never got to take that knapsack off, that would hurt.
It's a lot of butter.
Pop the knapsack off, you're like, wow, I feel better. Similarly, if you can reduce some of your weight through healthy ways, great way to reduce your knee arthritis pain.
And you know what? 30 pounds of kale is going to do the same thing.
Yes, you know how big your duffel bag would have to be to get to 30 pounds of kale, but I'd agree, it's going to help you. Okay, #3 is using modalities like physiotherapy, massage, acupuncture, that type of treatment.
Or physical therapy.
Physical in the US, physical therapy. So this can teach you ways to do functional exercise, to strengthen the muscles around your knee, which has been shown to reduce the pain. And massage and acupuncture are more specifically to reduce the pain itself.
Okay, moving on, braces.
Okay.
Depending on where your arthritis is in your knee, is it on the medial side? Is it on the lateral side? Is it in the patellofemoral joint? There are different braces that can be made, designed, or off the shelf available to treat that type of arthritis in your knee.
Right, off the shelf, or potentially a custom brace. So if you are severely bull-legged or knock-kneed, a custom brace can actually push your knee back into a more normal alignment, not to reverse your alignment deformity, but to reduce the weight on the most affected compartment.
Or if you're doing the Charleston, you're both.
Or the Charleston. And I would say in the same category as braces would be orthotics.
Yeah.
So if you can alter the way that your feet are loaded, it's going to translate into the way your knees are loaded and potentially reduce your pain. Okay, that was #4. Let's go on to #5. #5 is kind of the food area. So avoid inflammatory foods that can aggravate your arthritis and increase the number of anti-inflammatory type foods that you are consuming. We have specific videos about both of these topics, but food can play a big role. What are the main ones that we need to avoid, Paul?
Inflammatory foods?
Yeah.
Alcohol.
Alcohol for sure.
That causes inflammation.
Sugar, refined grains, and in general processed food. This is just generally good health and diet advice.
You might want to feel like drinking alcohol because you're in
Yes.
so much pain, but ironically.
Okay, #6.
Over-the-counter medications.
Okay.
You may think we're sponsored by pharma. We are not, and we're talking about medications that are off patent, so no one's making a ton of money off these, but things like acetaminophen.
Yep.
But you have to be careful with your liver with acetaminophen. That's Tylenol.
And actually recently they've been talking about maybe lowering the maximum amount of Tylenol that's safe, which is interesting because we used to always think it was super safe.
It is pretty safe. But keep an eye on that. Anti-inflammatories.
Yep.
Ibuprofen, naproxen.
Yep.
Those are NSAIDs, non-steroidal anti-inflammatories. They can help to reduce inflammation and reduce pain. However, they do have side effects because they can affect your kidneys, which can then give you high blood pressure. They can give you an ulcer, so you have to be careful with those medications.
#7, supplements. So supplements, not regulated like we've talked about in the past, but things like turmeric, glucosamine, chondroitin, MSM. Lots of anecdotal evidence to say that they help. We would say the response is certainly variable, generally safe. Risk is primarily financial, so it would be up to you to decide, and in light of other things that you're taking or other medical problems that you have, decide whether or not it'd be safe for you.
Okay. Prescription medications.
Nice.
Very similar to the over-the-counter medications.
Yes.
But you can get over-the-counter anti-inflammatories, acetaminophen, and you can get opioid over-the-counter in Canada. You can get Tylenol 1.
Right.
With a low dose of opioid. However, prescription medications are usually stronger versions or newer novel versions. So for example, there are newer anti-inflammatories that are more specific to joints.
Mostly to reduce your GI risk.
Yeah, and those are prescription only.
Yep.
And of course, the narcotics are available, but we do not recommend narcotics for management of arthritic pain.
Definitely not. Okay, topicals. So topicals play a big role in management of pain on a daily basis, and these are relatively safe because of their low absorption rates systemically. So things like local anesthetics, anti-inflammatories, nerve agents, even CBD is becoming more and more popular.
Yeah.
These play a role, and I'd say, speaking for my patients, half the people get benefit and half the people don't.
In the same area as skin, instead of putting it on top, we actually can sometimes go through the skin and do an injection, intra-articular injection. So that's an injection that goes right into the joint, right into the knee. And things we like to inject that can help are corticosteroids. There's been some news and some articles that say, oh, it damages cartilage, but if you're injecting a corticosteroid into a knee where the cartilage is all damaged, that's arthritis, then it's probably worth it if it gives you some symptomatic relief.
Local anesthetic?
Local anesthetic is often mixed in with that, doesn't last very long. Hyaluronic acid, which is a naturally occurring molecule in your synovial fluid that is lowered in amount when you have arthritis. So often we inject hyaluronic acid to lubricate, we say, the knee, but really it actually helps the chondrocytes or the cartilage cells make more hyaluronic acid.
I know.
It's upregulated.
And the last one is stuff that really does not have very good evidence, but again, it's commonplace because there's so much marketing, particularly in the advent of social media, where advertising is really cheap and it's just kind of constant barrage. So whether that's magnets or copper or red light therapy, I'd say actually there is some evidence for the red light stuff for some other medical conditions, but not necessarily for arthritis. But the evidence in general is pretty weak.
However, associated with those modalities is a pretty significant placebo effect.
We've talked about that before.
The placebo effect, almost 30%. So sometimes you use these modalities and you get relief. It might be the placebo effect, and if that works for you.
Okay, so that's our top 10. I would be remiss to say ice. We always forget it because it seems like it's such an obvious thing, but it's cheap, it's easy, it's safe. Just careful for frostbite because actually you can get frostbite from an ice pack. But it can make a huge difference on any painful area in your body. If you like this video, please like it, subscribe to our channel, leave a comment, tell us what you've used that's worked for your non-operative knee arthritis.
Got a little history here. We're kind of paying homage to one of our earlier videos where we did this
7 years ago
when we were kids.
Hardly.
We were just making videos for our own patients.
That's right.
And then it kind of blew up. And so we just thought we'd remake that video.
There you go. Subscribe to our channel. Check out other long-form content.
And remember, as always, you are in charge of your own health, man.
We'll see you next time.